Are you ready for a Kahoot? You feel better, Aaron? You know, after two classes, I think I know you well. So everybody, you know that tomorrow, 4 o'clock, I'll be doing exam 2 review. You'll have it posted in your announcements and with everybody else's in one announcement as soon as I have it. And you also know that you can go right to my YouTube channel, even get it a couple minutes earlier if you really want it that quick. Who wants to win Cahoots today? Aaron, do you want to win? No? Let's see who else we got. Xavier wants to win. Jamie's going to win. There he goes. Yep, he will. Kentrell, how about you? No?
You know I'm coming for the goal.
Ah, coming for the gold. All right, let's get going. Week 6, guys. Amazing. What is priority treatment for a newborn of a HIV positive mother? So what do you know? HIV, newborn, what is your concern? So HIV positive infant, our priority is to give that child every possible chance to fight the HIV. As I said, if you start early antivirals, improve that infant's immune system, I've seen children go HIV positive to negative in a year. Okay, so improve the immune system. What are symptoms of sickle cell anemia? So sickle cell anemia is the blood vessel gets occluded. So if there's no blood flowing, you'll see hand, foot, whatever swelling. Pain because it can't move, it's going to get bigger and bigger and press on nerves, it's going to hurt. It could go into the eyes, there's blood vessels, and of course delayed growth because you're not getting blood to where it needs to go. You don't have blood, you don't got nutrition, you're not going to grow. What kind of hematocrit would someone with sickle cell have and why? Remember, sickle cell anemia is all about quick blood cell destruction. That means the cells explode and they die quickly, right? So if that happens, it's going to be lower because those sickle cells die quicker. So they can't replace it quick enough. So as I said, every time I get a child in with sickle cell crisis in pain, their hemoglobin hematocrit, if it was below, above 6, I'd be a happy person. Rarely it was. What is the nurse's priority with a child with sickle cell disease who is currently experiencing a crisis? So priority is sickle cell disease. What happens in sickle cell disease? The blood vessels get small. Sickle cells get stuck. Swelling occurs. How do you treat it? We give fluids, we give heat, and in the other hand is the pain medicine. But the priority, let's relieve, not treat the symptom of pain, let's treat the cause, which is small blood vessels. Let's dilate them. Let's get those vessels moving through the blood system instead of stuck and causing pain. What is the reason children with iron deficient anemia are tired easily? So iron deficient anemia, that means you're not having enough cells. So you don't have red blood cells, you don't have iron, you're going to be tired. You have no oxygen, you have no iron, I have no energy, I'm tired. Decreased red blood cells. A multi. The nurse is teaching about newly prescribed iron supplementation. What should be included? I have seen this question on the last several HESIs, believe it or not. Probably on NCLEX too. I don't know why they pick it, but this is one of the ones. So remember, iron has to be broken down in the stomach by the stomach acid. So your stomach needs to be empty and absolutely no milk, okay? And if you drink it with another acid like orange juice, it's going to break it down further. Now, that iron supplement is brown and it stains teeth, just like the dextran that we give an IM injection that we want to give it deep. It's brown and it burns the skin, but the liquid will take the teeth and turn them brown. So drink it through a straw. And the other thing, as I've said, make sure you let that child and that parent know their stools are going to turn really black, or they're going to get scared. Aplastic anemia includes a depression of which blood cells? And then I look at the A and I say A is without. A without anemia. What's all the things that you see in anemia? And that's right, red blood cells, white blood cells, platelets. It's, as I said, very similar to like leukemia. All of those things are going to be there, and the treatment is like leukemia. Most common type of anemia is iron deficient anemia. Absolutely. Thank goodness it's not aplastic. That's a horrible disease. What causes pernicious anemia? B12 deficiency. That's in the stomach. It doesn't have it. It's not going to break it down. And you're going to end up with anemia also. Which symptom is the single most common symptom of anemia? And that's fatigue. Because remember, anemia, hemoglobin hematocrit, it's low. What does the blood cells carry? Oxygen and iron. If it's low, I don't have any energy to do anything. When teaching parents about beta thalassemia, the nurse informs that the child is at risk for what? Remember, with thalassemia, these rectangular cells burst. And what's in the cell? Iron and oxygen. So all that iron going out there is going to cause iron overload, requiring some sort of chelation therapy. Also, hypoxemia because oxygen is being exploded into the blood vessels and not being used. What lab values would you see with hemophilia? Remember, I said many times kids will come in and they're suspecting hemophilia, and they'll do this whole gamut of labs, all the factors, et cetera, et cetera. But they'll do a couple because we'll get the results right away and we will have a really clear picture. And that's because the PTT is prolonged. PTT prolonged shows bleeding, right? It's like giving too much heparin. PTT, they're bleeding. But the other points of their coagulopathy thing is PT, your platelets and your PT are absolutely normal. So if that PTT is prolonged and you're not on heparin, think. What is immune thrombocytopenia purpura? ITP. ITPP platelets, decreased number of platelets in blood. Yes, good. Thrombocytopenia can cause the following symptoms. ITP. Remember, it's usually following an upper respiratory infection. Remember, there could be acute. We can treat it, but there's also, if we can't turn it around, it will become a chronic condition. What we see with thrombocytopenia or low platelet count is some sort of bleeding, which is petechial hemorrhage. This is a little purple things, demarcation rash thing. And then the ecchymosis, and then maybe nosebleeds. And actually, nosebleeds is what gave us clue on many patients who came in that ended up with ITP. A multi. Child with hemophilia has fallen, the knee is swollen and painful. Treatment would include, how do you treat hemophilia? He bumped his knee, fell down. Look at it. It's painful, it's swollen, it's ecchymotic. What are you going to do? You have hemophilia, you're bleeding. So if you are bleeding, you want to rice, right? Raise it, ice it, contain it, and elevate it. You're going to put cold packs on, constrict it to stop the bleeding. Heat would cause it to bleed more. What is the priority nursing action for a suspected blood transfusion reaction? I've seen actually several blood transfusion reactions in my children. And yes, number one, you stop it. What is the most common transfusion reaction that I have seen? And it's going from a no fever, because you take your vital signs before you start it, and 15 minutes later, you take the vital signs complete again. And it went from no fever to 101. That is a transfusion reaction. You might see, the difficulty in breathing or rash or stuff like that, but usually it's a fever. A child is admitted with neutropenia. Which nursing action takes priority? What is neutropenia? What does that mean? Isn't it something to do with neutrophils? What are neutrophils? They're white blood cells. I'm having a problem with white blood cells, neutropenia. I want to make sure I'm washing my hands. I want to make sure that I'm doing proper infection control. And that's as simple as it is. When that will help protect that child. Which symptom would a healthcare professional expect to see in a child with leukemia? So in leukemia, remember your white blood cells are low, your red blood cells are going to be low, your platelets are going to be low, and you're just going to ache and pain everywhere. So it's bruising, it's fatigue, it's bone pain. Absolutely. Your child with ALL has had recent lab results with platelet counts of 10,000. What do you need to do? How are you going to make a care plan around an ALL patient with a platelet count of 10,000? And then I'll ask you, does it matter what condition they have? What are you going to do for a kid with a platelet count of 10,000? What is your big concern? It's all about bleeding. Very good. Again, doesn't matter ALL. It could be a kid just coming to the hospital and then you see it. A multi. A child is placed on bleeding precautions for ITP. What interventions would the nurse do? Bleeding precautions. So with ITP, you're worried about bleeding. So you don't want to put a needle anywhere. You're going to look to see, are they bleeding? You're going to look at the CBC. What are the platelet counts doing with the treatment we're giving? And you're going to treat with corticosteroids. And that means if you're bleeding, you're going to give it, which you will be. So you're going to give corticosteroids. A child with Wilms tumor. Which action by a nursing student causes a faculty member to intervene? Remember the Wilms tumor? The tumor is very fragile. They won't even do a biopsy to confirm it because it is so fragile. A child with ALL has a fever of 100.5. What should they do? So when you have a child who's immunosuppressed, whether it's ALL, cystic fibrosis, sickle cell disease, it doesn't matter, immunosuppressed, and they have a fever of 100.5. This is a child that needs to call the doctor immediately and be placed on antibiotics. Remember, there is no immune system here. Immunosuppressed needs to be placed on antibiotics immediately. Call the doctor, or they can go into septic shock quickly. Your child's having a bone marrow aspiration. What should you tell the child? So again, in children, be honest and let them know it's going to hurt a little bit, but we'll do everything we can. Most common clinical manifestation of that retinoblastoma, the retina. And this is that cat's eye reflux. That's when it sort of looks white, or like when you see animals in the dark, you put a light on, you see these white glowy things. That is what it looks like. It's called cat's eye reflex. Your child's been diagnosed with a retinoblastoma. What information is important? What do you need to know? So it's all about tell me everything that anything with your eyes. It could be related, it may not, but again, finding out all of the information with the assessment's important. A goal of surgery for a child with an osteosarcoma is osteosarcoma. And when we talk about that, we're talking about the femur bone. So you have a child with osteosarcoma of the femur. What is our goal? So we can't just take a piece of tumor off a bone. The whole bone is infected. The whole femur bone has to be taken out. But what they try to do is take the lower leg and put it up into the hip to have something to put on a prosthesis. Can you imagine that? So it's called salvage the limb so that we can put the prosthesis on. And if we can't, then of course it's an amputation. A child's complaining about skin markings for radiation therapy should be told what? You know those purple marks they put on you? So these markings have to be kept there because it shows exactly where to point the radiation gun to put it in the same place. You know, those little purple markations, a lot of times they'll have these big, you're done with radiation, let's have this washing off, big ceremony, make a party out of it. But they can't. They have to leave them on to make sure it's the same place all the time they're given that radiation. When distraction is used, it helps what? So distraction, when you use it with children regarding pain, regarding having to do a procedure, anything, it really takes their mind away. I mean, kids, give them an iPad, give them a sticker, turn on a cartoon. Those things will focus away from what you're doing, and they're not going to feel as threatened by you. What assessment question needs to be asked to a child with possible rheumatic fever? This was a question that was missed by some of you on the quiz this week. There are two conditions that is caused by a strep infection that that needs treatment. Now, rheumatic fever is caused by a strep infection, sore throat, that was either undertreated or not treated at all. Our biggest concern is mitral valve damage, because once it's damaged, it's damaged. The other stuff, the rash, the polyarthritis, the chorea, all that stuff will go away. But the mitral valve, the damage will be there and has to be treated medically or surgically. Signs and symptom of asthma. Another one from last week. So it's coughing, shortness of breath. Remember, it's expiratory wheezing, not inspiratory. Very good. A multi. What symptom would be reported to the healthcare provider for a child with sickle cell disease? I mean, what's the ones that are really worrisome? We have an ordinary that always happens, the worrisome stuff. It's all about worried about stroke or maybe chest pain, pulmonary embolus, those things. These children are going to have swelling in the hands, the feet, the knee, the elbow, the finger, or whatever. But our biggest concern is that headache or chest pain. Is it a sickle cell attack or is it whatever? We have to make sure there's no, things that can happen because we didn't treat it. Absolute contraindication for nasal tracheal suctioning include which of the following? So anything in the oral pharyngeal airway that's already has swelling in there, or you've done surgery, leave it alone because you're just going to create either more swelling or more bleeding. Very good. Iron dextran is given which root? So iron dextran is an injection. It's brown, it burns, and it discolors skin. So we do that Z-track. I call it a lock and load. You pull the skin up, you put the needle in, pull it out, and you lock and load it, and that keeps that medicine underneath the skin. So it's deep IM Z-track. A child's about to receive their own bone marrow. This is called a what transfusion? Remember we had some names there? We have allogenic, autogenic. What are they? Which one does it mean? When it's mine, it's automatically mine's the best. Very good. What cancer may present with painless, firm, enlarged cervical nodes? These. And it's Hodgkin's lymphoma. Remember, cervical above the shoulders, Hodgkin's. When it's everywhere else, it's in those lymph nodes, it's non-Hodgkin's because it's not that big node that we see. A multi. When teaching about sickle cell disease, you would include what? You would absolutely give as many fluids as they will drink to keep those blood vessels dilated. Very good. Dress warm. Take medicine. These kids are given Tylenol number twos or number threes as kids. And if they're having pain, they're told to take it before they come in so we don't get it too bad. And again, any autoimmune patient, fever, you worry about infection. They need medical care. That you will see globally, any diagnosis, fever, autoimmune, you need to get care. Thalassemia major is treated primarily with what? Thalassemia major. Cooley's anemia, rectangular blood cells bursting, right? Putting iron and oxygen into the body. It's very caustic. And it's treated with blood transfusions. There's no other treatment. You have to just keep giving blood. A multi. Treatment of osteosarcoma includes. Remember, osteosarcoma, we're talking about the femur bone. What do we do? How do we treat it? How do we get rid of that cancer? It's either amputation or you salvage the bottom of the limb, and we're going to give chemo and maybe radiation. Stem cell does not work for this, not at all. A multi. Who are the best donors for bone marrow transplantation? So the best one we know for bone marrow is always yourself. But if not, your siblings are the other choice. Mom and grandma, that's half of what you've had. So siblings, mom and dad, you've got a better chance of not having rejection. What is the most common opportunistic infection for children with HIV? Children, adults, don't matter. It's the most opportunistic infection. Hmm. It's good old PCP pneumonia, right? I mean, the other one might be the Candida. They're always getting those yeast infections, but the most common and probably the most concerning is that PCP pneumonia. What would you consider to be neutropenia or low neutrophil count in children? Remember what I've told you about having a low neutrophil count. Doesn't matter why it's that low. Any child, any adult that has a neutrophil count of 500 or less and is running a fever, that child's about to, or that adult's about to go into septic shock. So less than 500. Above that, it's normal. You're usually right around 1200 to 2400. It's usually about the normal. Less than that, there's nothing to fight infection. A primary characteristic of a brain tumor. This little tumor start to grow. It's putting pressure inside the brain. What are you going to see? And it's growing and it's growing. So it's the symptoms that get worse over time. Headaches that get worse over time. Wakes you up from sleep. The headaches are so bad. Vomiting, not related to eating, and then starting to get, unbalanced and falling over things and getting worse over time. The optimum treatment for osteosarcoma is, you know this now. So our goal, if at all possible, is to save the bottom leg and put it there so that there's something to put a prosthesis on. Okay? So it was either amputation or salvage the limb, right? Which one did you choose? A child is receiving the induction of chemotherapy. What does that mean? It's your last question. Remember, chemotherapy, there's 4 stages. The first one is the most intense of all of them. It's about 4 to 6 weeks, and our goal is remission at the end of induction. Now, that's the first of 4 stages. The other 3 stages are there to catch any little stragglers and making sure there is no cancer. Let's see how we did today. Number 3, Cam. Good job, Cam. Number 2, Elma, good job. Number 1, drum roll, Tata. Who's a Tata? Jasmine and Aaron. Good job, guys. So we're on week 6. Again, please get in your project, your diagnoses, so I can approve them. If I don't get to you right away, please just let me know so I can help you. Sometimes I think I hit send and I didn't. So if I don't get it back right away, just please send me another message. Remember, this is the week of exam reviews. Next week, we'll be having our exam. Anybody who wants to meet me before exam, let me know. I will do my review on Tuesday. If you want to meet with me, see the exam review first, and then come to me with questions and we'll go over it so that you have a better concept of what's going to be on the exam, okay? You do have dosage calc there if you need it. It's all exam 2 questions, types. If you can do it, you'll be fine. You all have a great day. Thank you.